Good evening, good morning and good afternoon everyone, and welcome to all of you who have joined us for this pre-summit affiliated session. And tonight we're going to stand up for women with a session from the Women's Nutrition, Economic Empowerment and Leadership in Food Systems cluster. Before we start, I would like to inform you that we will have live translation of this session in French and Spanish. So if you go to the translation button in the end, and also in the chat function, there are instructions on how to make sure that you can listen to this session in French or in Spanish if you would like so. So this cluster combines 3 game-changing solutions, and many stakeholders have been involved in preparing for these respective proposals. And we don't have time today to mention all of them, but we would like to recognize their hard work and support. And this is the second in a series of sessions to bring on board country partners and to help shape the cluster's future agenda, the way of working and the operationalization. So in the first consultation meeting, which was held on June the 29th, several countries already expressed their interest in this cluster, stating that it was relevant for the priorities and activities that are being articulated in national dialogues. And this session aims to take the consultation with country representatives one step further, with statements of support from countries and donors and joint identification of the next steps. So we have an excellent lineup of high-level and inspiring speakers for you today. My name is Saskia Ozendarp and I'm the Executive Director of the Micronutrient Forum. And I would like to start by introducing to you now Dr. Jemima Newkey, who is the Director for Africa at IFPRI and is the custodian of the gender lever of the Food Systems Summit. And she will introduce to you the Coalition of Action on Women, of which this cluster is part of. And she will introduce the next speaker as well. So Jemima, the floor is yours.
Thank you so much, Saskia, for that introduction. Excellencies, distinguished speakers and guests, thank you so much for joining us for this session on Standing Up for Women, where we're discussing women's nutrition, empowerment, and leadership. I will give some background to the work of the gender lever. The gender lever really was formed and constituted due to the recognition that gender inequality and women's empowerment are critical to transforming our food systems so that they cannot just be sustainable and nourish all, but they also do this in an equitable way. So we know that inequalities are both a cause and an outcome of unjust food systems, that women and girls continue to be disproportionately affected by chronic hunger and malnutrition, but that at the same time, our food systems have inequalities that have rendered women's voices and leadership invisible despite the roles that they play as producers, as processors, as traders, and as consumers. But also recognizing that there is a right to food as well for all groups, irrespective of what their roles are in food systems. But we also know that women are important interlocutors of household nutrition, but their own nutrition can sometimes be compromised, either due to inadequate access to food, but also social norms that limit what women can and cannot eat, and their positioning within families. So this cluster of bold actions is part of a set of a much broader group of solutions that we have been discussing as the gender lever over the last 12 months. Now, the gender lever has been working in 3 main ways. First, developing and working with stakeholders and mobilizing voices of women around the globe to contribute to a set of solutions that help to address gender inequalities in food systems. We've also been working with other stakeholders, especially action track leaders, to ensure that whatever game-changing ideas that they put on the table as part of the UN Food System Summit, that they are actually using a gender lens to see how those solutions, how those game-changing ideas, how they will impact the nutrition and the empowerment of women and girls. And the third thing we've been doing is really making sure that the voices of different women across the globe, indigenous women, women producers, women consumers, women working in different parts of food systems value chains, that their voices are actually part of the UN food systems process. So we have a set of solutions. I'll mention a few, but not all of them. One is to increase access to technologies and other resources that women need, either to produce or to participate meaningfully in value chains and in markets and to grow their businesses, including digital technologies. Two is to guarantee land rights for women, to make sure that women actually do have the rights to the land that they use to produce food, because we know women's access to land can be based on relationships, and when those relationships end either as daughters or as wives, that their land rights can be compromised. So really calling for both legal and traditional processes that guarantee rights of women to land. We are also calling for example, for an alliance of financial institutions that provide transformative financial inclusion for women, financial inclusion, financial services and products that actually work and respond to the needs and priorities of women. We are calling for gender responsive and feminist policies by governments that really build on gender responsive budgeting, that have gender specific outcomes and indicators for tracking progress in terms of their impact on women and girls. But also another broad set of game-changing ideas around applying transformative approaches that address the social norms, the power imbalances, cultural and gender norms that continue to act as barriers for women and girls. So there is a full set of solutions around which we are forming a coalition and calling on stakeholders, calling on member states, calling on the private sector, civil society, women's rights organizations and movements to be part of the conversation. So I'm going to speak very specifically to women's leadership in food systems organizations, because other speakers are going to talk more to the nutrition and empowerment part of this conversation. And I'm really grateful to our partners, Global Health 50/50, who've been working with us tirelessly using some of the data that they've been collecting over the years to look at how food systems organizations, or those organizations that transcend both global health and global food systems, how they're performing in terms of gender equality within their leadership, in their policies, in terms of who holds power within those organizations, but also in terms of the outcomes and the extent to which their outcomes are addressing gender equality. So the Global Health 50/50 is a regulars organizations of over 1,200 organizations, and using data for some of these organizations, this team at Global Health have helped us to come up with a Global Food 50/50. This is meant to be both an accountability mechanism for food systems organizations in terms of how well they're doing on gender equality, but it's also supposed to be a motivation for them to actually do better. Now, the analysis shows some really good news, and some not so good news in terms of how these organizations are doing. So the good news is when we look at commitment to gender equality or public declarations by organizations about their commitment to gender equality, we find that 65% of these organizations commit to gender equality for the benefit of all. In terms of internal policies, about another 67% have gender equality policies and plans with specific measures, and another about half of them have policies on diversity and inclusion. So still needs a lot of improvement, but also seeing that there is some commitment on to gender equality from these organizations. And the not so good news is in certain areas like who holds power, that the inclusion of women, the inclusion of other groups not as much. So only 25% of board chairs, for example, are women, and 25% of CEOs are women, and only 6% of CEOs and board chairs are women from low and middle income countries. So seeing some areas where there's really room for improvement. And in terms of outcomes, what this analysis shows is 54% of organizations are collecting sex disaggregated data in their reporting. So just slightly over a half of them. And so what we are doing this evening is a pre-launch of this Global Food 50/50 in terms of a brochure that is going to be available online shortly, but doing a full launch of the report during the summit in partnership with Global Health 50/50. And as you can see from this, in summary, it is really mission critical. I said this earlier in our session today, that it is mission critical that we address the issue of voices and leadership of women in food systems. And we are hoping that this coalition that we are putting together will take some of these actions forward. I would like to stop there, Saskia, but it is now my pleasure and honor to invite Dr. Leah Tandese, who's the Minister for Health of Ethiopia, where I know there's been quite a lot of progress in terms of addressing nutrition, in terms of coordinating between sectors. I heard you, Honorable Minister, speak yesterday at the sessions here in Rome. Thank you so much for joining us, and the floor is yours. Over to you.
Sorry. Thank you very much, Dr. Jamima, and greetings to everyone. It's really, truly an honor and a pleasure to join this very important session, and particularly dealing with women's empowerment and nutrition. As was already said, women are really key actors of the food transformation we seek, with a crucial role in maintaining household food security and beyond. Although their socioeconomic contributions, their leadership, and their entrepreneurial potential often remains unrecognized and untapped. And in Ethiopia, as in many African countries, although women are vital food system actors, they face many challenges. Women, particularly in rural areas, have multiple responsibilities, including farming, fetching water for the household over long distance, fetching firewood, childcare, food preparation, while simultaneously engaging in trading of the food they produce or buying from others. Poverty, inequality, and cultural and traditional practices limits women's ability to provide better diets for their families. As we all know, more nutrient-dense crops, such as green leafy vegetables, are considered women's crops and have received little attention in our agricultural development efforts. And women also face challenges with limited access to skill trainings, formal education, and innovative agricultural inputs, and access to finance. The other key challenge they face is that they have limited ownership and control over productive assets, with women farmers performing up to 75% of farm labor, but they only hold around 18.7% of agricultural land, according to our assessments in the country. So malnutrition is the inevitable outcome of food systems that do not work for women. And this is also evidenced by women and children being the most affected in undernutrition and in micronutrient deficiencies. One of the key challenges we face in Ethiopia is a high prevalence of anemia, particularly in women and children, with prevalence of as high as 24% for women in reproductive age group and as high as 57% for under 5 children. So accelerating action for women's nutrition and also its focus on micronutrients, particularly anemia, as an entry point to address women's nutrition presents an opportunity to address this more holistically and ensure that underlying causes of anemia are addressed as well. In Ethiopia, to address this, we have routine iron and folate supplementation for women in antenatal care through our primary healthcare services, which is one of our key performance indicators across the entire system up to our lowest community health extension program. And in addition, weekly iron folate supplementation to adolescent girls in and out of school is being implemented in few districts and now being scaled up to over 100 districts. So the interrelationship of nutrition and women empowerment is really clear. And in Ethiopia's government has now strong political commitment towards women empowerment. Very encouraging initiatives are there, although we have a long way to go, which starts from the bold goal of having women comprise 50% of leadership roles at different levels, which is started to be implemented from our cabinet and different federal institutions, which of course needs to go to all levels and across sectors. There are also social and economic aspects of reform policies and initiatives to improve women empowerment, particularly improve land ownership of women, supporting women, small and medium enterprises, and also making the workplace conducive for women. Just 2 examples would be recent maternity leave has increased from 3 months to 4 months, and also a strong policy is in place now for accessing daycare centers within workplace and communities for women to enable women really contribute and work. So we have to continue to strengthen the appropriate integration of gender into planning and implementation of all our activities and support women's empowerment, particularly for rural women. And I really take this opportunity to applaud the UN Food System Summit Solution Cluster that has intertwined with women's nutrition, economic empowerment, and leadership as essential for the food system transformation we envision. And accelerating action around these 3 key approaches can enable women feed their families, but also ensures that women are engaged and enabled to contribute towards the transformation we envision in food systems, because that will have a ripple effect by empowering whole communities and our nations. So on behalf of the government of Ethiopia and the Ministry of Health and myself, I really would like to thank the organizers and affirm our commitment to build on our efforts in this innovative cluster that addresses challenges women face and brings synergy to the food system transformation. Thank you so much.
Thank you so much, Your Excellency, Dr. Lia Tadesse. And thank you for sharing your insights that if food systems don't work for women, it will lead to malnutrition, and applauding Ethiopia's commitment to empower women in leadership roles and across the board to make sure that that also nutritional status is being tackled in an integrated way. And thank you also for Dr. Jemima for your encouraging words and for explaining how this cluster fits into the broader coalition of action. I would like now to give the floor to Dr. Hazel Malapit. She is a senior research coordinator at IFPRI, and she's the gender lead for Action Track 1 of the Food Systems Summit. And she will explain in more detail this cluster to you and introduce the next speakers. Hazel, the floor is yours.
Yes, thank you so much, Saskia. It is such a pleasure to be here today to give you a quick overview of the solution cluster on accelerating action for women's nutrition, empowerment, and leadership. And as we just heard, greater gender equity is an essential prerequisite to food systems transformation. So our big idea here is to strategically focus on 3 distinct but connected elements of gender in food systems that offer concrete, feasible, actionable, and mutually reinforcing entry points for systems change. So First, on nutrition. We know that the burden of malnutrition in all its forms fall disproportionately on women, which reinforces the vicious cycle of gender inequality. So improving women's nutrition not only addresses one of the most inequitable outcomes of food systems, but also ensures that women are healthy and able to participate in food systems transformation. The specific entry point here, as been mentioned, is a new alliance for anemia action. So the focus on anemia will bring attention to the role food systems must play to support women in accessing nutritious foods in a way that gives women a voice in the actions taken. Second, on economic empowerment, it is well established that women's empowerment correlate with better nutrition and other economic benefits. So the specific entry points here are hubs designed to support women-led enterprises, generating income through production and value chain activities, focusing on vulnerable women producing nutritious crops, especially indigenous crops, thus leveraging women's already important yet marginalized role in this area. And then third, on leadership, as we heard from Jemima, women's voices are typically missing from decision-making processes in the food system. And so the specific entry point here, as we heard, is to create accountability for food systems organizations to appoint women as leaders, to enact gender-responsive internal policies, and be accountable for gender outcomes through this global food 50-50 reporting mechanism. Next slide, please. So we believe that taking these three actions forward in a coherent, interconnected way will create a multiplier effect to achieve mutual complementarities and synergies. So the Alliance for Anemia Actions proposes a coordinated multi-sectoral response to the multiple causes of anemia, combining food systems, health systems, and environmental approaches. It may also act as an entry point to other forms of malnutrition experienced by women, including obesity and diet-related non-communicable diseases, given that anemia is found in women across the underweight to overweight spectrum. And then next, increased income and decision-making about that income is one of the most important interventions for improving women's diets. So this would be one of the multiple benefits of the hubs, which include, for example, regional level incubators and challenge funds to empower community level leaders of women's food system enterprises. So these hubs will support enterprises that are focused on profitable, nutritious foods, including indigenous crops, and will enable women to generate income, feed themselves and their families, and increase local access to nutritious foods. They also aim to be transformative by changing social norms and mindsets. So for example, if women gain decision-making power and acquire feelings of self-respect and self-efficacy, this could catalyze further changes. For example, opening up opportunities to form self-help groups and to receive extension finance and other services. And then finally, as Jemima mentioned, the rationale for the Global Food 50-50 initiative emerges from the Global Health 50-50, an accountability mechanism that highlights the lack of gender equity in leadership of global health organizations. So in that same spirit, the Global Food 50-50 will review performance and catalyze change in policy and practice across 200 organizations active in food systems, including research, private sector, nonprofit, and government institutions. So this initiative has the potential to catalyze a cascade of changes throughout food systems. So more women leaders and decision makers could mean, for example, more support for women-led enterprises and greater priority to investments and actions to improve women's nutrition. Thank you, so I'll end there. And now I'd like to introduce Professor Corinna Hawkes, who is the director at the Center for Food Policy at City University of London and was responsible for the Nutritious Foods Working Group of Action Track 1 of the UN Food Systems Summit. Over to you, Corinna.
Thank you, Hazel, and thank you for inviting me to help moderate this next session. And it's great to be here today. So we're now going to have a session where we're going to have 3 countries, and those countries will be discussing, Kenya, India, and the United States, how the solutions which Hazel just laid out for you, how those solutions align with existing priorities in countries. So we're going to start with Maureen Muketha from Kenya, who is the founder of Tulevemia. And she will tell you a bit more in her video about what she's doing on the issues of women enterprises. If you could start Maureen's video, thank you.
Hello everyone. Women's nutrition and economic empowerment in food systems is an area that has a soft spot in my heart. Currently, food systems fail to deliver to the world's most nutritionally and financially vulnerable population. Low, variable, and unpredictable income limit the foods that women can be able to afford and access. This leads to inadequate intake of nutritious foods, placing the women and consequently their children at risk of malnutrition. My name is Maureen Muketha. I am a youth leader of the Act for Food, Act for Change campaign and the founder of Tulevemia. Tulevemia is a Swahili word for Let's Eat Right. Tulevemia is an organization that equips young women with technical skills through training them how to set up kitchen gardens or vertical gardens to cultivate indigenous vegetables for their household consumption and sale of the surplus to meet other household needs. This cluster of women's nutrition, economic empowerment, and leadership in food systems perfectly works to strengthen Kenya's food systems. When we look at the idea of women enterprise hubs, it envisions to have capacity building fora and activities such as improve access to seeds of nutritious foods, as well as marketing of these foods, not forgetting peer-to-peer learning, which is a critical aspect. The Alliance in Anemia Action seeks to address iron deficiency anemia through improving access to safe and nutritious foods. Iron deficiency anemia in Kenya is actually one of the micronutrient public health concern. This action may also be a low-hanging fruit to improve other forms of malnutrition, such as obesity, which accounts for 33% of women of reproductive age. A famous quote by James Charlton says, "Nothing for us without us." I believe with women in nutrition leadership, development and streamlining of policies will be more gender responsive, therefore improve nutrition among women. With this, I therefore invite you to this cluster and work towards actioning and implementing this in your respective countries. Thank you.
Thanks very much to Maureen for that inspiring video. We're now going to move to India. I'd like to invite another two videos to be shown by Dr. Hemalasa, who is Director of the National Institute of Nutrition in India, and Dr. Nyoji, who is Director and Dean of Research at the International Institute of Health Management Research in India. If you could start those videos, please.
Hello, greetings from ICMR National Institute of Nutrition. Anemia has been a persistent problem in India despite strong policy and program commitments from the government. In 2018, Anemia Mukt Bharat was launched by the government of India, which envisages to reduce anemia aggressively through a set of 666 strategies, like 6 groups of beneficiaries, 6 types of interventions, 6 performance indicators, etc. The Anemia Mukt Bharat aims 30% reduction by 2022 among children, adolescents, pregnant and lactating women, and women of reproductive age, covering 450 million beneficiaries. The Indian government has policies centered on nutrition education through programs such as the National Rural Health Mission, Integrated Child Development Services, and Anemia Mukt Bharat. However, social and behavioral change communication will work only when accessibility and affordability of nutrient-rich foods are made possible for women and children. Good nutrition is elusive to most women in India. Studies have shown that she is responsible for completing the majority of unpaid work in the home. Women are expected to prioritize the health of their family over their home, thus affecting their health care. And moreover, women lack time to visit Anganwadi centers to obtain iron supplements. As per recent studies, women's autonomy to lead the household to seek healthcare is also limited. Empowering women with education and control over income can play a crucial role in shaping her status that can result in improving health and nutrition outcomes for women and children.
Hello everyone, greetings from India. We know that Anemia Mukt Bharat or Anemia Free India is India's flagship program. One of the key strategies here is to strengthen the institutional mechanisms which are set up at the national, the state and the district levels. In order to facilitate the activities, the Steering Committee for Anemia Mukt Bharat has been created, which is headed by the Secretary, Ministry of Health and Family Welfare, and that committee is represented by several departments as the Secretaries of Women and Child Development, Human Resource Development, Department of Drinking Water and Sanitation, Ministry of Rural Development, Ministry of Panchayati Raj, and Ministry of Tribal Affairs. They are members of this particular group. Inter-ministerial convergence is also being ensured via the existing convergence platform under Poshan Abhiyan. Poshan stands for Prime Minister's overarching scheme for holistic nutrition, or in short, the National Nutrition Mission. The approach laid out in these documents and strategy notes are very gender inclusive and gender empowering. There are several schemes available to support women-led food enterprises to produce nutrient-rich foods using locally available food items. This not only would lead to women empowerment, but also lead to the availability of nutritious food available at their doorsteps. So we understand that anemia is a reflection of overall status of nutrition, for which food safety, food security, nutritional diversification, every component play some or the other role. And success of anemia related programs is intricately related to all these components which are aptly covered under Poshan Abhiyan. Thank you.
Thank you so much for those videos from those speakers. And in Kenya and India, we've heard about the alignment with the priorities set out in this cluster, and with women's enterprise from a view from Kenya, and from India, the alignment with anemia. So I'd now like to turn to Meredith Sewell, who is the lead Inclusive Development Division of the Bureau for Resilience and Food Security at USAID, to talk live. And Meredith, welcome. I'd like to ask how the presented cluster fits with the priorities of USAID.
Yeah, thank you, Karina, for the introduction. And it's great to be here today to talk about women's empowerment, nutrition, and leadership, and the links between the three. The United States is deeply committed to advancing gender equality and women's empowerment globally and within food systems. And we know that agriculture and food systems are the key to empowering women worldwide and to ending poverty and hunger, which hold women back from reaching their full potential. And women cannot reach their full potential as entrepreneurs, leaders, and mothers, and all the many roles that women play without proper nutrition. Due to anemia, millions of women suffer from greater fatigue, leading to lower work productivity and a poorer quality of life. That is why anemia reduction is an important focus of our work, and it requires coordinated action in several sectors, mainly health and food systems. As we address anemia, women will be further fortified to lead as entrepreneurs and throughout food system organizations. For women's enterprises, the U.S. government recognizes the private sector as a key contributor to transformed food systems, and women need additional support to become entrepreneurs that are leading that transformation. Programs that provide support to women for their specific needs, including digital access, solutions to unpaid care, and access to finance and markets, must be expanded, as is recommended by this solution cluster. As one example, we support AGRA's Value for Her initiative that aims to increase value for women in agribusiness. Also, national laws or regulations that inhibit women's ability to establish and grow businesses must also be examined and changed. And we must also change from within in the organizations where we work on global food systems. In the United States, the Biden-Harris administration takes gender and diversity within our federal agencies' workforce and programs very seriously. The administration has established a White House Gender Policy Council with a mandate to advance equal rights and opportunities for all, regardless of gender or gender identity, in domestic and foreign policy, including by promoting workplace diversity and inclusion across the federal workforce. We're really pleased to see the pilot brochure of the Global Food 50/50 Index that Jemima and Hazel highlighted, and look forward to seeing what can be achieved by assessing how food systems organizations are measuring up to their gender commitments. We believe this report will spur action and increase accountability for gender equality in food systems institutions, increasing diversity and leadership roles for women. Thank you.
Thank you so much, Meredith, for those comments and for sharing with you how the work that you are doing is aligned with what is proposed in this interlinkage of solutions in this cluster. So thank you very much indeed. We will need to move on now to the next part of this session, which is statements of support by governments, or statements by governments around the commitments that they are making in this area. What we want to know and what we want to understand is what commitments a country is already making that align with these proposed solutions. What is going on in countries? And so I'm delighted to welcome Dr. Furu Lema, Senior Advisor to the Minister of Health in Ethiopia and the Scaling Up Nutrition Focal Point in Ethiopia. Welcome. And Dr. Freddie Mubanga, the Sun Focal Point and the Deputy Director for the National Food and Nutrition Commission in Zambia. If you could put on your video and sound, Mr. Mubanga, that would be wonderful. Thank you. So thanks very much for joining us. So if I could turn to you first, Dr. Lema, what commitments have you made in Ethiopia that are already aligned with this cluster? We can't hear you, Furu. I think the mute.
Thank you very much. Sorry. Yeah, Ethiopia has a unique platform that is called the Women Development Army, which actually arms women to help them change the health and nutrition of themselves and their families. So we are planning to use these, and we have accommodated one of the game changers. We have launched on July 15 as a game changer that aligns with this platform, and it also has a sustained awareness creation and also food and nutrition literacy to help change the consumers that they consume nutrition diets, foods, and safe foods using the Women's Development Army, and change them to women empowerment as well as food system leadership. So Women Development Army in Ethiopia are at community level, at grassroots level, and they have been working particularly focusing on health and nutrition, but using their experience, which has shown that they are well accepted and have changed mothers to help care for children and health as well as maternal health and nutrition. We are engaging these development army, which are leading a 1 to 5 group arranged to a 1 to 30 group. And these women are model families, and their deliveries have been quite very interesting because the child health and nutrition, as well as mother's reproductive health, has been quite improved when they are development army members. So we are using these to align with the food system transformation plan and engage them based on what the training they have, modify so that they could have an income generating activity linked within the existing training system, as well as engage as leaders for advocacy towards working to transform the food system they are living with and being developed. So that's what, and one of the anemia cases, which is also a high issue in Ethiopia, will hopefully be addressed through the existing communication abilities of Women Development Army and their engagement within their neighbors and communities at large. All in all, I think Ethiopia is committed and has support of the cluster of solutions that have been identified. And we have already positioned our to contextualize these within our game changers, and we hope to be working with you and continue the support of doing what we are already doing and hit the road running in terms of women empowerment, nutrition, and leadership. Thank you.
Well, thank you very much. And thank you for your support. And thank you for the work that you're doing in Ethiopia, which I have to say sounds fascinating and incredibly important, and clearly very game-changing and inspiring for us as well. I'd now like to turn to what's happening in Zambia, to Dr. Mubanga. So what commitments have you made which are aligned with this cluster?
Well, thank you very much. And what I can say is that we are excited with this gender lever, in the sense that the current situation is that within the broader framework of the national development planning under the human development cluster, and we are seeing that the synergies of the food systems, the health systems, and the social protection, they are blending well in terms of having impact in improving micronutrient deficiencies, as well as stunting and improving on the health of women. For example, within the health systems, we are still promoting the iron folic supplementation, DWEMI, whereas in the food system, we are promoting the iron-rich beans, and we are also promoting this consumption of small livestock. And we've also now brought in the element of, a community savings to try and empower these women so that they should be able also, besides producing, they should also be able to consume and also earn income from the excess that they sell. So the scaling up nutrition is actually now within the structures it has established, with a focus at community level, where we have our nutrition support groups. That is, every household needs to be reached by the volunteers. This approach is actually helping to ensure that the services from the health, the agriculture, the social protection are blending and fusing onto those households. So with this lever, we are grateful that we'll be able to learn more and also take advantage of the game changers and see that we reduce anemia, which is quite high among women and adolescents, as well as children. And we feel that with the current approach of bringing the sectors together is something that we are confident we should be able to get better benefits in enhancing the human development. So as a country, we are grateful that we will be more aligned with this coalition to see that we learn more as well as share more on the greater effects that we are already seeing. I thank you.
Well, thank you. And again, very impressive to hear about the different range of things that you're doing in Zambia to advance this agenda. And it's clear that there are so many things that can be done and should be done to advance this agenda. And it's great to hear from the two countries, Ethiopia and Zambia, on your inspiring examples for others to follow, which of course is so important for this UN Food Systems Summit, is to provide the opportunity to inspire and share. So thank you very much indeed. And with that, I would like to pass back to Saskia. Over to you, Saskia.
Yes, thank you, Karina, and thanks to all the previous speakers and for the interesting statements of support and lessons already learned from countries, particularly Ethiopia and Zambia, who are leading the way. And we would like to, we're running short of time, but we would like to still give the floor to you, the participants of this session, and ask you, to share your perspectives regarding this cluster and its relevance for you. So what we will be doing now is we will not have time to let people speak, but we would like to give you a few minutes to reflect, and we will like to get your answers in the chat box regarding one or more of 3 questions that we will share with you now. So Gurmit, can you please put these questions on the screen? And we would like to let you know that we will use your thoughts and summarize them as a source of inspiration and to further develop this cluster and into the coalition of action. But we will of course not use any reference relevant to your name or your affiliation or your country. So here are the questions. The first one is, which part of this solution cluster fits with initiatives in your country and how does it fit? The second question is, what entry points do you see for operationalizing this cluster in your country? And the third question is, would you like to be actively involved in further developing this global cluster proposal or in developing the global cluster, the cluster proposal at a national level? So please do not be shy and share your thoughts in the chat box now. We give you a few minutes. Thank you, Shushibi Kobe from Nigeria, for sharing with us the work that you do in Northeast Nigeria on women nutrition. We'd like to hear from more of you if that's possible. You don't need to answer all the questions. You can pick the one you prefer. We'll give you 1 more minute to answer one of these questions if you see fit. And thanks very much for your statements of support. And gracias, Katy de la Nicaragua. Thanks everyone. Kermit, can you stop the music? Thank you very much for all your input and your suggestions. We will take this forward and we will reach out to you to further develop this cluster and develop the coalition of action. I would like to thank all the speakers and the moderator and participants for their lively engagement after this powerful session where we were standing up for women. And it's especially heartening to hear from all of you and read how the proposals in this cluster really resonate with you, and that the elements of this cluster are being integrated into the country commitments to the Food System Summit. So in the 2 months remaining before the summit in September, we encourage countries to do the following: to step up and commit to women nutrition, women's economic empowerment, and women's leadership in their journey forward towards more gender equitable food systems, to integrate dedicated actions and investments on these areas into your national action dialogue processes, and to inform us about your intents and let us know if you would like to have support. And finally, to coordinate and communicate your national priorities so that they guide the summit's work and actively engage in the development of this coalition of action on making food systems work for women and girls that Jemima Yuki highlighted in her introduction. So from our end, our next steps are, and our commitments to you are, that we will bring additional stakeholders on board for this cluster and in its specific work areas. And we will elaborate more detailed work plans, especially regarding the operationalization of this cluster at country level. And then a specific point on the action, the Alliance for Anemia Actions, and I know that both Dr. Freddie Munganga and Dr. Furulema refer to that in their country context in Ethiopia and in Zambia, because this game-changing solution brings food, social protection, health and environment sectors together, and therefore the proposal will be further developed beyond the Food System Summit towards the Nutrition for Growth Summit in December. So we encourage countries to address the food systems solutions through the Food System Summit, and then to continue participating in the discussions and the dialogues to develop a multi-sectoral approach to anemia reduction with commitments at the Nutrition for Growth Summit in December. So finally, I would like to encourage you all to let us know, if you have not done yet through the chat box, about your interest to actively participate in the development of this cluster and in the coalition of action. And the full concept note of this cluster is available on the summit's website and will be shared through this chat. And we will also make the recording of this cluster available to you through YouTube and through the social media channels. And with this, I would like to end today's event. And I would like to thank you very much for all your active participation. And I'll see you next time. Bye-bye.